when I started, I was severely osteopenic, like
Yeah.
at age 45.
From 45, and how old are you now?
I'm 71.
71.
Right.
From 45 to 71, you've been gaining.
Very slowly for a while. Then with Algical, I went up into normal range, and
Wow.
now I have the bone density of a healthy 30-year-old.
That's amazing.
I don't think most people understand this, including many doctors. I was living on ibuprofen
Oh, no.
until we figured out, and then I had the surgery. And
Oh.
remember? And I called you because I was so relieved I had come up to get the DEXA done.
Yeah.
And I was afraid that it was
Yeah,
going to be
after all the insights.
terrible.
Oh, well, not
Yeah, well, not terrible, but I was afraid that I would have lost bone somewhere.
Oh, yeah.
And I didn't. I gained,
Amazing.
despite the accident. So we met because I wanted to talk to you about all the research that you were
yeah.
doing. Remember
Yeah,
in Seattle,
yeah,
and
yeah.
you were there for the DEXAs. And I had read about your research, and I had just published the first edition of my book.
Right.
And as I was reading the research, like I do every morning,
Yeah.
I saw your studies, and so I called you, or I wrote you and asked you for the papers, and then you said you were going to be in Seattle, and then you said, why don't you try Algical, and I'll send you 6 months. And after that 6 months, I was no longer osteopenic.
Wow. Wow. From highly osteopenic to no longer osteopenic in 6 months.
Well, I went from really bad osteopenia, I was like halfway better.
Right.
And then, but it was slow. It took me years to move from really bad to halfway bad. And then 6 months on Algical, and I was excellent, and I've stayed there.
They looked through all the science available and found that there was no compelling evidence that exercise alone can increase bone density. So like you said, it's a team, right?
It is. I wrote a post on that.
You need the bone-building nutrients. If you don't have the bone-building nutrients, same with trying to build muscle, right? If you can exercise your face off, but if you don't eat anything...
Right, no protein, no muscle. I really think the trace mineral content, which is unique to Algical, is the key.
I think so too.
Yeah, so I'm really interested to know, how did you figure it out?
Well, Laura, you know this already, but most of the published science is out there for 5 to 10 years before before the doctors hear about it or before it even gets anywhere. So it was the early days of the company, and I became an amateur researcher. I just dug in, I went into PubMed, read everything I could get my hands on. I was always interested in science and improving human performance, and I try to live as naturally and healthfully as I possibly can myself, and so it was just a lot of fun as well. I loved it, and it was so exciting to see that traditional calcium supplements and what everyone was promoting was just calcium, 1,000 milligrams a day, and vitamin D at very low levels, 400 IUs per day. And yet the science was showing that at 800 IUs, there's a little bit more benefit. And even higher, there was more benefit. And going back even further, that calcium alone studies showed absolutely zero improvement in bone mineral density. Then they did vitamin D studies alone, and it had zero improvement on bone mineral density. But when they combined them, there was a modest slowdown in the annual rate of bone loss. And so I got very excited about this concept of combining nutrients together. There was also some early studies about vitamin K2 combined with vitamin D and how the two of them were creating some benefits. So I thought, what if I combine calcium, vitamin D, and vitamin K2? Oh, and then there's these things called trace minerals. And I read about how vanadium was studied by the USDA in the 70s. So I started looking at all the other minerals, and zinc and boron, molybdenum, and through more than a year of really digging into the papers, I learned that there's 13 minerals and 3 vitamins that I could see, at least 3 vitamins, but arguably at least 3, and 13 minerals that are required for healthy bone. And yet traditional calcium supplements had calcium and D, sometimes Cal, Mag, and D, but that's about it. I determined that we were going to create some clinical studies that would study a multi-nutrient approach. Let's put everything together. In the end, it was better because I said, what I really want to do is make an impact. And to do that, we need K2, we need boron, we need magnesium, we need everything all together, 13 minerals, three vitamins. So that's what we tested, and that's how we came up with these formulations. So
it's an outstanding supplement. I still, I have a lot of respect for you. I am blown away that you figured it out.
Yeah, well, it was just reading and learning what's already out there. People have studied so many of these different topics in depth, and when you look at the overview and put it all together and then try it, lo and behold, it works.
Very few people put it all together. I frankly don't think people should wait until they have bone loss to start supporting their health with a product like Algacal.
Yeah.
I have my 30-year-old son who's a medical doctor. He takes Algacal. I have my 41-year-old daughter who is a nutritionist, and she takes Algacal. I want to thank you for making it available to people, because there really is no other resource like what you provide. It's just not out there.
We're very thankful to have bumped into this years and years ago, and took every little dollar that we'd made and put it into some studies to find out whether it was actually any better. And then to our shock and amazement, it was even better than what we thought it would be.
Yeah.
Now we just need to get out there and get the word out.